The nose job or rhinoplasty is one of the commonest procedures done from ancient time, and it actually started in India by the surgeon named Susrusha. Rhinoplasty or a nose job can be done surgically and non-surgically. That means liquid rhinoplasty is the term for non-surgical rhinoplasty, by which we put some filler to give some augmentation and change the form of the nose. In a surgical rhinoplasty, we do by two approaches, a closed approach and an open approach, and by which we can change the shape and the form of nose. So when I examine my patient after taking the brief history, I normally look for the angle of the nose, that's from the forehead, how it takes off. Then the dorsum of the nose, the height of the nose from the face, and the tip work or a tip framework. This picture demonstrates the anatomy of the cartilage framework in the nose. The dorsum of the nose is formed by the septal cartilage, upper lateral cartilage, and the bony septum is formed by the vomer bone and the nasal bones. You can see the lower lateral cartilage gives the tip framework, and that is also to be corrected when the tip is droopy or when there is a boxy. Now the rhinoplasty, which has been done as a liquid rhinoplasty or by the filler, a small amount of filler we put on the dorsum of the nose to increase the height of the nose, on the tip of the nose to give the good projection of the tip, at the base of the nose, at the anterior nasal spine to give the good angle of the nose. It is an office procedure and the patient can get back to the routine on the very same evening or in 2 to 3 days if there are small prick marks. The surgical rhinoplasty, on another hand, is an extensive procedure with the recovery time may range from 7 days to 14 days, and it's more structural work which we do in an open and a closed rhinoplasty. For that, to increase the height of the dorsum, we use costal cartilage or concha cartilage or a nasal septum cartilage, which we harvest from the septum of the nose. To do the tip work, the interdomal stitch and an intradomal stitch with some columnar strut graft normally been put to give the good height of the tip. Now, example. If I want to draw a tent on a floor, you can imagine the whole weight of the tent are on a few support bamboos. If the height of the bamboo is lower, the tent will look more flatter. And to increase the projection, we have to increase the height of a bamboo or a support. At the same time, if the floor is sloping, the whole tent will look droopy. Some of the cases, we have to elevate the floor to increase the projection of the nose. On this diagram, you can understand the principles of rhinoplasty, how it's been done and what's been done to give a good aesthetic nose. Very few of my patients also demand for the threads for the nose, but the fundamental is same. I have to put something to increase the height of the dorsum. That could be autologous tissue, that means the tissue from your own body, or a tissue which is available or a form which is available outside like filler or threads. To know the more details of the nose job, you can contact my clinic on this number. You can visit my website, you can contact me on my Insta handle, and we will get back to you. Thank you very much.